Hey everybody, my name is student Dr. Cameron Olsen, and I'm excited to present to you a little bit today about Heidi, a patient that I saw recently. Now Heidi is 32 years old. She claims she's a female. She just got a new job, which is really exciting, and I always like to congratulate patients when there's a major life event that happens, as well as take into consideration how this might change or affect their health. She came into my practice because she needed a physical for this new job specifically. And it's kind of an interesting case because she didn't have a major uh, severe problem coming in. So it seems to be a routine physical, at least at the beginning. Something to consider quickly is Heidi's genetic sex, just to make sure that you have all the information necessary to appropriately treat Heidi. Like we said, Heidi doesn't have a major chief complaint as far as a severe severity goes, but this is what she does report when she came into the office. She said she's had recent shortness of breath. She also mentioned that she's had an unproductive morning cough, that she's also had a weird feeling in her toes. Now, we don't know what weird means. It's kind of subjective, and so we would definitely want to explore what that means to her. Tell me more. What does weird mean to you, or how does it feel, or describe that for me. And then we would always want to know when these things are happening. So, you know, when do you feel short of breath, or when did it start happening? What brought it on the first time you noticed it, that sort of thing. Now, one thing we don't know as well is what recent means to Heidi, because she said, well, recently. That could be days, it could be weeks, it could be months. We really don't know, so we'd want to ask her about the onset. Absolutely. She's had the unproductive morning cough recently as well, and the feeling in her toes, the weird feeling she described, is periodic. She said it's often present after she goes on a run. Heidi really likes to run. She does it often for exercise, and so she said that it's common after she runs. Things we would definitely want to ask her: timing, have her describe the weird feeling. I would definitely ask her, do you ever have trouble breathing out? Or do you feel like you can't get enough air in? When does that shortness of breath happen, and how does it feel? Because that will help us to delineate further respiratory issues, if that is what it ends up being. Now, we took a patchy medical history from Heidi, and these were the only things that we could get from her. She said that she has had general good health, which is fantastic. When she came in the door, I thought that she was perfectly healthy. She said that she jogs 6 to 8 miles per week, like we mentioned. She has that weird feeling in her toes after she runs. She said that she's seen an OB-GYN yearly, but that she hasn't seen a different physician for about 3 years. One thing that really caught my ear about Heidi is that this new job that she has is located in a recently renovated warehouse near a river. Now, that to me says red flag. Definitely want to look more into this because it's an old building. It was built in the 1800s. Who knows what could be there? Who knows what problems this could cause, or what pathogens or allergens she could be exposed to. So that definitely raised a red flag when she said, oh yeah, we work in this really cool warehouse office building that was renovated. She also reported that she's sexually active with a long-term partner, and that she's on next plan on a contraceptive implant. She reports that she has about 4 to 6 drinks of alcohol per week, and that she does not smoke. Some things we'd want to ask Heidi would definitely be, what does she do specifically at work? What is her main responsibility? Is she loading trucks? Is she on a computer? Does she handle anything that could be toxic? Does she clean? We really don't know what she does, and that will really change um, the potential diagnosis or suspected illnesses that she could have based on what she does. Also, definitely want to ask her if any of her coworkers have felt the same symptoms that she's had. That could definitely be an indicator to narrow down. If there is something happening, it might be because of work. Definitely want to ask her about allergies. Other medications she's on, she says it's just Nexplanon for now, but yeah, definitely want to make sure. I would ask her about current and prior aspirin intake. And this is something interesting. Aspirin can actually cause a type of asthma. It's called aspirin intolerant asthma. And with high doses of aspirin, it can actually induce a type of asthma. That's why I'd ask about that. I would ask Heidi about her current medical conditions, anything out of the ordinary or things that she's currently being treated for, and also her family history of disease in order to find out any chronic or genetic um, diseases that could affect her health. I'd like to go over a general review of systems, ask her if she's had any fever or chills, any weight change. She said she's had an unproductive cough, and a fever or chills might indicate that she had an infection. We definitely want to ask her about about her respiratory symptoms. Shortness of breath, she's reported. She's reported some wheezing as well. She also reported that unproductive morning cough. As far as musculoskeletal goes, we would want to ask her, as we mentioned, she's reported a weird feeling in her foot. We'd want to ask her more about that. And then also ask her what aches, what pains, um, any other injuries as far as musculoskeletal systems go. We'd want to examine Heidi in order to gain more information as well about her situation. If she really has something wrong, if she really is sick, or if she's just getting over a cold or a viral infection. The exam definitely could be normal, but we'll look a little bit more about this in a minute. The differential diagnoses that I went with are asthma. Because of the symptoms mostly, it seems that shortness of breath. She also reported some wheezing and coughing. The majority of her symptoms were related to respiratory system, and so immediately I thought that definitely could be an allergen-triggered asthma. It could be potentially peripheral neuropathy with a viral infection. That would explain her symptoms. But peripheral neuropathy would really need a reason. So I guess it could be due to excessive running, causing the weird feeling in her toes, if that was a paresthesia. And then the viral infection could explain the cough. Maybe the shortness of breath as well. Pernicious anemia, maybe. It could cause some of the paresthesias as well as the shortness of breath. But she hasn't reported any of the other major symptoms of anemia, like lightheadedness and those sort of symptoms, so less likely. So the main diagnosis that I went with was asthma, and it was likely caused, I would suspect it's caused by a warehouse or other allergen. It could be worsened or caused by exercise, and or made worse by a viral infection as well. Let's go back to the exam. Now, if Heidi is currently symptomatic with shortness of breath or any of the other symptoms that we mentioned, we definitely want to see how bad it is. That's a great way to assess the level of treatment and to ensure the diagnosis. If it is asthma or a different obstructive respiratory illness, we'd want to watch for prolonged exhalation, pursed lips, that wheeze, taking a long time to breathe out, really cautious breathing. And because wheezing definitely increases the likelihood of a correct asthma diagnosis. Other things that are associated with asthma are atopic dermatitis, eczema, an allergic skin reaction, because it is a autoimmune disease that can be triggered by allergens. Nasal polyps are also related with a severe type of asthma. The pathology of asthma is pretty straightforward. It's a bronchial constriction due to inflammation. It's caused by T cells, and it can be triggered by an allergen, medication, environmental exposure. Something even as simple as cigarette smoke can aggravate and bring on asthma. What happens is cytokines are released, cytokines like IL-4, IL-5, IL-10. These induce class switching to IgE, which can create the allergic response, lead to inflammation. IL-5 will lead to eosinophil recruitment, and then IL-10 will lead to more stimulation of Th2 cells and inhibition of T helper 1 cells. So all of this leads to a response. IgE triggers this response to mast cells to start inflammation and inflame this area as if it was pathogenic. Chronically, this will lead to bronchoconstriction, which is the main issue in asthma. The things we want to do to help Heidi, once we can get more information and confirm that asthma is correct, is to identify when the shortness of breath becomes worse, see if other people at work are ill, and try to eliminate that allergen or whatever it is that's causing it, wherever it may be. As far as medication goes, we'd want to prescribe a beta agonist like albuterol and check if that works about 3 weeks later. If it isn't controllable from a beta agonist, we'd want to look at inhaled corticosteroids, but those have associated risks. So we definitely want to start with a beta agonist. Some things we want to consider as far as ethics goes. It may be difficult for Heidi to accept that she has a condition. She's young, seems pretty healthy. It may be difficult for her. We want to make sure as a physician to give the correct diagnosis so that we do her good, as well as avoid the wrong diagnosis and ensure the treatment is appropriate to minimize risk and provide her with non-maleficence. We want to make sure that our interaction with Heidi is just. So we'd want to make sure to give her time to discuss the situation, what we're going to do, and what the future looks like for her. It was a pleasure working with Heidi, and we'll see her in about 3 weeks to make sure that things are under control. Thank you.